Hello, my name is Maribel Alvarado, and this is my Create AState project. Are Hispanic patients in a rural health clinic with a hemoglobin A1C of 6.5% or greater diagnosed with diabetes compared to the Hispanic national average? The purpose of this study is to compare a diagnosis of diabetes with the hemoglobin A1C of 6.5% or greater in Hispanic patients at a rural clinic in Northeast Arkansas compared to the national average. According to the American Diabetes Association, type 2 diabetes diagnostic criteria involves having a fasting plasma glucose of 126 or higher, a 2-hour plasma glucose level of 200 or higher during a 75-gram oral glucose tolerance test, or a random plasma glucose of 200 or higher. The ADA also deems an A1C of greater than or equal to 6.5%. Therefore, utilizing this criterion will help answer what percent of Hispanic patients with an A1C of 6.5% or higher are diagnosed with diabetes compared to the national average of 24%. Now, guidelines in practice for patients with type 1 diabetes recommend screening for diabetic complications 5 years after diagnosis. For patients with type 2 diabetes, screening begins at diagnosis, and you screen for complications including foot exams, fundoscopic exams, urine testing for albuminuria, measurement of serum creatinine, and lipid profile. Healthy People 2020 report the percentages of U.S. adults above 18 are receiving recommended preventative care assessments and how these exams are essential for better health outcomes. This includes annual dilated eye exams, A1Cs more than twice a year, annual foot exams, daily self-monitoring of blood glucose, and ever-attended diabetes self-management classes. So the method used for this study was a randomized retrospective chart review, and it was obtained from 30 charts with the demographics focused on Hispanics amongst the age groups of 18 to 65. So there were 30 charts, and they demonstrated whether the hemoglobin A1C levels were elevated, were indicative of diabetes, prediabetes, or normal. The data showed that of the 30 charts reviewed, only 6 lab values demonstrated elevated hemoglobin A1Cs, and 11 others revealed a prediabetes level, resulting in 13 of the patients under this ethnic group not having indications of diabetes. Of the 6 cases that were considered abnormal A1C levels in diagnostic criteria for diabetes, 100% of them had been diagnosed with an ICD-10 code E11.9. A hemoglobin A1C of 5.7 to 6.4% is indicative of prediabetes or at risk of diabetes mellitus, and should be findings all clinicians have a knowledge base of and provide regular screenings for. So to conclude this study, it did demonstrate that 100% of Hispanics with hemoglobin A1Cs were diagnosed correctly with diabetes, as recommended by the American Diabetes Association. Within this category, 20% of the charts reviewed were diagnosed diabetic Hispanics, 37% were pre-diabetics, and 43% were considered to be normal lab values. According to the national average, diabetes is prevalent in 24% of the Hispanic community and is expected to increase as further education is provided. I would like to take this time now to acknowledge Arkansas State University's Dr. Christopher Jordan for being my mentor during this process. And below you'll find my references to support the evidence used for reviewing the guidelines and research for this study. Thank you once again.